Hi, my name is Ron McNutt. I'm a physician assistant. A little bit about my background. I've been in medicine about 20 years now. I was a Navy corpsman for the first 10 years of my medical career in the Navy. And then I was an ER nurse for about 5 years, and then I went to physician assistant school. Now, physician assistant school, after physician assistant school, I got my master's degree in physician assistant studies from Loma Linda University. And I began working with Dr. Kincaid in August of 2007, and I've been with him since. My role function in this office is primarily as a surgical physician assistant. What that entails is assisting Dr. Kincaid in surgery, along with seeing pre- and post-op patients on a continuing basis. My secondary functions in the office is that I deal with mostly non-invasive type aesthetic treatments that help to improve a patient's overall aesthetic appeal, over the short term. Most of these patients that I see on a daily basis for aesthetic procedures typically are in their 30s, 40s, and 50s, not quite ready for facelifts or more invasive procedures. There is a plethora of products that are available to the general public. The neurotoxins currently out on the market are Botox and Dysport. Both are botulinum toxin A's, both of which have literally the same function in that they help to reduce facial rhytids or wrinkles and help give you a smoother, younger appearance. Now these botulinum toxin A's typically are used in the upper part of the face, meaning the glabella, this area, the forehead, and crow's feet. Those are the typical three main areas that we use these botulinum toxin A's on. The major difference between the two products really is minute, in the sense that they both last approximately 3 to 4 months, and they both give the same desired effect, which is a reduction in the facial rhytids or wrinkles in the given area of the face. There's really not an advantage between one product or the other. Typically in my practice, I see a slight increase in result from Dysport than I do from Botox, meaning that a lot of my patients are getting a 4-month result with Dysport versus a 3-month result with Botox. And that could be related to the dosing of the product, because Dysport is 2.5 times stronger than Botox. But besides that, there really isn't much difference between the products. The other products that are available are things like Juvederm, Restylane, Juvederm Ultra Plus, Perlane, Radiesse. Those are all facial fillers. What are facial fillers? Facial fillers literally do exactly what they sound like. They fill lines or wrinkles in the face. They're used primarily in specific areas. They're used primarily in the nasolabial folds, so these folds here, the marionette lines, and also for lip augmentation. Those are the three main areas that we use facial fillers currently. There's another group of products that are revolumizers. As we age, we lose volume in our face. We lose fat, muscle, bone. Our skin loses collagen, gets less elastic, and so our face starts to fall towards gravity. And so we end up with increased jowling, increased nasolabial folds, increased marionette lines with age. The main product currently on the market is a product called Sculptra, and it's a polylactic acid, and what it does is it rebuilds collagen. The highlight of this product is it rebuilds collagen over a long period of time, so it's not the wow factor or the instant coffee, I like to say, that you get with fillers. There's another product that's called Radiesse, which I mentioned in the filler category, but actually has applications in both filler and tissue augmentation. Radiesse I use a lot in the cheekbone area to accomplish the same feat as Sculptra. However, the length of result isn't as long as Sculptra. Sculptra lasts 2 to 3 years. Radiesse will last about a year. The highlight of Radiesse is for those patients that don't want to wait the 45 days for the result. You get instant coffee. You get instant results. So that's what a lot of patients, they want to see improvement today. They don't want to see improvement 45 days from now. The chemical peel that I currently have in this practice is a peel called the VI peel. And the VI peel was first introduced in Beverly Hills about 3.5 years ago. And it works phenomenally well to help increase the tone and texture of the skin, to help brighten up the complexion. It helps with fine lines and wrinkles. It helps a lot with dyschromias and brown spots, melasma. It just helps to really brighten the complexion of my patients. For patients who have serious melasma or deep acne scars, then laser is going to be the most beneficial for them. Whether that's, most patients are coming in for correction of, skin surface irregularities. So laser resurfacing now has become the standard, really, for those types of conditions. The laser that we do here, which I like, I really like the laser that we do here. We use erbium laser because it has more affinity to water. Thus, there's less pain following the procedure, unlike CO2. Carbon dioxide and erbium are kind of the two players out there in the laser market. And I think really, erbium kind of wins in the sense that our patients aren't on fire after the procedure, and so our patients are much more comfortable following the procedure, and the results are almost identical. There's one other modality that I like to use in regards of tightening the skin around the eyes, around the mouth, and that's a modality called portrait plasma. Portrait plasma actually delivers deep heat, gas heat, to the tissues and causes collagen neogenesis like laser. The reason why I like it is because I've seen phenomenal results around the eyes and around the mouth for perioral rhytids or loose skin or elastosis around the eyes. It really tightens up the skin fold, and it helps to alleviate the perioral wrinkling around the mouth from years of sun abuse, smoking, straw use, etc. And so that's all of those modalities work very, very well to help patients achieve their aesthetic goals, but from a non-surgical standpoint. It's an ever-growing practice that you have to stay on top of, and you can't get complacent in this business because there's always new things coming out on the market. It really takes, you guys really stay on top of in continuing education, learning about these things, so you can offer them to your patient. You always want to be known as offering the latest procedures to our patients to help with their aesthetic needs.